Okay? Are you ready? Okay, so we are starting with the skull. So the bones of the skull, this is the frontal bone here, and this is the zygomatic bone here. Okay, and the zygomatic bone is the cheekbone. In front you have the nasal bone. So the nasal bone and the zygomatic bone are the two prominent bones in the skull, and which are commonly fractured. And this is the upper jaw. It's called the maxilla. And can somebody give me a mandible?
Oh, yeah.
This is the lower jaw, and this is called the mandible. You can see how this is the only bone that moves, which has got a joint, and this joint is called the temporomandibular joint. So that's the temporomandibular joint. And in the maxilla, you can see the maxilla holds the upper teeth, and the mandible holds the lower teeth. Okay, the part of the maxilla which holds the teeth is called the alveolar process. Okay, so on the side here, you can see this is the frontal bone, and behind the frontal bone you have two parietal bones. That's the parietal bones. And behind the parietal bone you have the occipital bone, and the occipital bone is what has a big hole in it. This hole is called the foramen magnum, and that's where what passes through the foramen magnum? The spinal cord. So the brain continues as the spinal cord, and this is the hole that connects the two. So if you look at the occipital bone here, occipital bone has got a little saddle here just to connect with the cervical vertebrae. So from here, the vertebrae is starting, and the first cervical vertebrae is what we call the atlas. Okay, and I showed you atlas has also got a little blunt, a flat area which communicates with the occipital condyles. So this is occipital condyle. This is the foramen magnum, and there's a lot of holes here. Holes are called foramen, and the important foramen is the foramen magnum. Obviously, that's the biggest one. And then you have the jugular foramen. That's where the jugular vein passes. And over here you have just over here you have the carotid canal. This is the carotid canal here, and so the carotid artery comes here, and it enters into the skull through here, over here and here. This is the carotid canal. So these three foramen are very important. And over here you can see a bone on the side of the head. This is the temporal bone, and the temporal bone has got a process here called the mastoid process. This is a mastoid process. And over here there is a process like a spear that's called the styloid process. So you have a styloid process and a mastoid process, and this is the temporal bone we are talking about. Temporal bone also has got the external acoustic meatus, which is your ear canal. That's where the ear canal passes. This is external acoustic meatus, and that's actually where the mandible joins. So the that's why it's called the temporomandibular joint. It's a temporal bone and the mandible. It's a joint, temporomandibular joint. So we talked about the maxilla, and here this is a nasal cavity. You can see the nasal cavity has got a little partition in the middle. This is called the nasal septum, and this nasal septum is formed by a bone which is located in the skull, in the middle of the skull. This is called the ethmoid bone. This is the nasal septum is the upper part of the nasal septum is the lower part of the ethmoid bone. This ethmoid bone has got a little spear-like process here, and that's called the crista galli, and it arises from a flat surface here, and this flat surface has got some holes. Can you see it? Yeah, these holes are it's perforated by some holes. It's called the cribriform plate. And the cribriform plate is where the olfactory nerves, which is a nerve which is responsible for smell. So the olfactory nerve passes through the cribriform plate. And when you look at the skull from the top, you can see the skull can be divided into 3 areas. You take that. Can you just